Hello everyone, this is Ishan and welcome to lecture number 15. In this particular lecture, we are going to focus on a particular country who has shown the world that with certain measures and timely action, it is possible to contain the virus. So let us have a look at the story of Vietnam in today's lecture. This lecture is presented by ICHNISAN or INS, which is Australia's first multilingual dialogue center, focusing on research publications, lectures, and also on fieldwork and conveying dialogue between people who like to bring in not just academic research but also on-field knowledge to sort out issues that affect our society. Now, make sure that you like and subscribe to Ichni-san on YouTube, because if you do so, you will also receive a notification for any videos that we upload going ahead. Also, I would recommend that you write a comment in the comment box of YouTube, because once you write a public comment in YouTube, your views could be read by the rest of the world, and you could actually engage in a dialogue and conversation with people from different parts of the world, and that is the actual intention of these particular series. So welcome to lecture 15. Make sure you like, subscribe, and you also write a comment in the comment box. So let us start with our lecture today on the story of Vietnam during the COVID-19 pandemic. Let us look at a few arguments before we actually focus on Vietnam. And these arguments are not specifically targeted at Vietnam, but these arguments arise when people talk about success stories or failures of certain countries. For instance, when it comes to Australia, a few weeks ago, Australia was being praised by the world. New Zealand was also being praised by the world for their containment of the COVID-19 virus and also the way they handled the situation. But one of the key arguments that came out arose out of developing or underdeveloped countries was that Australia and New Zealand are basically rich and they are developed. So they do have the necessary or required infrastructure and higher standards of living that make the containment of the pandemic easier compared to what the developing or the underdeveloped countries have to go through. So this is one of the arguments that people have been presenting when particular developed countries are being praised for their actual action plan and their response to the COVID-19 situation. The other argument is that poorer and developing countries face the issue of containing the uneducated masses during the pandemic. So the argument is that a lot of developing and underdeveloped countries have higher number of illiterate or uneducated people, and getting out the policy to these people, letting them know about the safety precautions or the implementation of the containment is difficult because they are uneducated. So that's one of the arguments that comes out of the developing countries in response to why they're not able to contain the virus. And the last argument that is really significant is that developing countries have higher density of population, which makes social distancing difficult during a pandemic. And I've said this in one of the previous videos as well, that when the Western world points out fingers at the developing world and say, well, the number of cases is rising out of control, what they fail to also mention or analyze is the population density. Take the population density of India, for example. It's massive, okay? Just Mumbai alone has a population density of more than 30,000 people per square kilometers. So with this high dense areas, it is really difficult to maintain social distancing, which is one of the key responses to containing the virus. So these are the three main arguments that people have been presenting. And now we're also going to see if these arguments fit the story, the success story of Vietnam. We say Vietnam is not a developed country. So the argument that goes, well, it's difficult for underdeveloped or developing countries to contain the virus doesn't hold true for Vietnam, because it is not a developed country. It's not a rich country either. So Vietnam is not rich, it's not developed, and still it has managed to contain the virus. See, the GDP per capita is approximately 2,600 US dollars. That's the annual GDP per capita. If you want to put that in perspective, India's GDP per capita is 2,000 US dollars. That's, I'm talking about annual figures. China's is 9,800 US dollars, and Australia's is approximately $58,000. So if you put that in perspective, you come to know Vietnam's GDP per capita is very similar or very close to that of India. It is very densely populated. In Vietnam, there are 311 people per square kilometer. Again, let's put that in perspective. In India, the average is 382 people per square kilometer. What I said before of 30,000, that was just for Mumbai. But if you're putting the entire India in perspective, and entire Vietnam, of course, in the perspective of comparing the two countries, then we see it's very similar again. China is 150 people per square kilometer. In Australia, it is just 3.2 people per square kilometer. So yes, there is an argument here that Australia was able to manage the virus because of the population density. It's sparsely populated, just 3.2 people per square kilometer. Compare that with India or Vietnam, more than 300 people per square kilometer. But then, if you're comparing India and Vietnam, okay, the story is very similar, but the containment is not similar at all. And that's where we have to have a discussion as in why this is happening. Some people say Australia was able to manage the virus because, well, they could pump in all their money towards healthcare because they don't have to put money in defense. People say because Australia does not share borders, okay, it's an island country, a continent by itself. So in that situation, well, the argument doesn't hold true for Vietnam. And there have been people saying, well, does Vietnam really have any border issues? Some say they don't, and that's why it was easier for them to contain the virus. That's not true at all. Vietnam does have border issues. Vietnam has border issues with Cambodia. They have border issues with China as well. It is religiously diverse too. It has 6 major religions. So if people were to argue that Vietnam has just 1 or 2 religions, and other countries which are religiously diverse find it difficult to educate certain masses or people of certain religions, and that's why they are failing to contain the virus, that argument doesn't hold true for Vietnam because it is religiously diverse as well, with 6 major religions. It is a tourist attraction, so again, it's not an isolated country that no one cares to visit. It is a hotspot for tourism. It is in fact one of the fastest growing tourist attractions in the world. So all these points or all these facts are not really favoring Vietnam when it comes to containment of the virus, but they still did. And that is because they reacted to WHO. So on 10th of January 2020, and this happened very early in January. Now, many countries are denying what has happened, but if you follow the timeline, if you follow all the publications, you come to know that on 10th of January 2020, WHO issued a comprehensive package of technical guidance online, okay, with advice to all countries, not selected countries, to all countries on how to detect and test manage potential cases of COVID-19 based on what was known about the virus at that time. So WHO keeps updating information as research comes in. Okay, it's not a magical organization. It's based on research and ground reality trials and facts, and this is what they had told. So this guidance was shared with WHO's regional emergency directors to share with WHO representatives in each and every country. Now, Vietnam, unlike many other countries, they reacted. They immediately published infection and prevention control guidance to protect health workers, recommending droplet and contact precautions when caring for patients, and airborne precautions for aerosol generating procedures conducted by health workers. You see, Vietnam was already coming up with a policy to tell and train their healthcare workers, their hospitals, about 2 forms of the spread of virus through droplets and even if it's airborne. Now, recently WHO did say that they are acknowledging that the virus could be spread in air as well. It could be airborne as well. See, Vietnam has started taking care of that way back in 10th of January from that point. So they were just prepared with everything. No blaming WHO, no pointing fingers saying, well, WHO, you just said it's droplets, you didn't say it's airborne. Why should we not, why should we put money for airborne precautions? No, they had an approach that looked after all possibilities. So this is an approach that was very commendable. It's an approach to really care for the people, not an approach to point fingers and blame someone for the mistakes. In late January, the Ministry of Science and Technology in Vietnam, of course, hosted a meeting with virologists to encourage the development of diagnostic tests. Once again, the key people who are experts in the field, these are the ones who were consulted. It wasn't made into a political game. Starting in early February 2020, publicly funded institutions in Vietnam developed at least 4 locally made COVID-19 tests. So they already had those ready in February, and they were validated by the Ministry of Defense and the National Institute of Hygiene and Epidemiology. So here you go. The right organizations, the right institutions and departments were active, and they came up with what they were supposed to do, the reason for why they were receiving the funding in the first place. Subsequently, private companies such as Viet A and Tai Duong offered capacity to manufacture test kits as well. So they were looking at the government departments and branches to take care of things, but also actually gave the responsibility to some private companies in Vietnam to take the initiative to come up with testing kits. A clear message was sent to people. So this is very important when you have success stories that contain the virus. A clear message and frequent messages by the top leaders, not a one-off message which is unclear and vague. So while leaders in many countries downplayed the threat of COVID-19, the Vietnamese government communicated in very clear, strong terms about the dangers of the illness even before the first case was reported. So some countries actually mocked Vietnam at the time and said it was overreacting. Well, interestingly, it wasn't overreacting. On January 9th, the Ministry of Health first warned its citizens, when January 9th, about the threat. Since then, the government has communicated frequently with the public, adding a short prevention statement. So not a political statement saying, let's be brave, let's do this together. A crisp and clear, precise message asking people exactly what they need to do. A lot of people, in fact, data says that each and every citizen of Vietnam received a phone call and a text directly taking advantage of Vietnam's high use of social media as well. So a text to each and every citizen, phone call to each and every citizen. There were 64 million people on Facebook. Each and everyone on Facebook was contacted as well by the government. So so this communication policy was already in place. Even if it's a developing country, they knew how to get the message very clearly to their citizens directly from the government. So that way, you don't have fake forwards or fake messages or rumors spreading around. You know, the government is calling you, you get that number on your phone, the government is telling people on Facebook, they're telling people on television as well, where the text is coming from, who is going to make the phone call, and everyone, before even people who try to spread rumors, before they could react, a clear message was sent from the government to the people. And I think that was a very good grounding, a beginning to control the COVID-19 situation in Vietnam. Now, Vietnamese scientists developed their own test for COVID-19 as well as early as January and managed to improve it to provide results within 80 minutes with a 90% accuracy. So Vietnamese scientists were on top of their game as well, of course, with the support of the government. In comparison, now let's compare this with Korea, who is also being commended by some. They had a quick test, but that had an accuracy of just 5% points lower, okay? So Vietnam had a better accuracy rate compared to that of Korea. In March, Vietnamese tests began, and they produced at a scale that was marketed abroad at a cost ranging from 16 to 24 euros. So by March, they not only had enough test kits for their own country, but they had also reached a level where they would export test kits to other countries. And as we know, many Western countries or many large economies of the world started their reaction. They began to react in March. So now we know the groundwork that Vietnam had already done from January, and there's no secret. No one had secretly texted them about what's happening. They listened, like I said, and reacted to WHO. They reacted at the right time, even if some say they overreacted. And by March, when other countries began panicking, they had to show some reaction, and some leaders had to point fingers and play the blame game for their failures. Vietnam was ready with the exports of their test kits to the world. Economic activity in Vietnam did slow down. Of course, it's not magic. No country is immune to this particular downplay in the economic activity. It slowed down due to the early restrictive measures and partial lockdowns, so it did get affected. It hit hardest the travel and hospitality sectors, which of course is happening around the world as well. Now, most of the hotels in the country are closed and domestic flights have been halted. Now, we have seen this in other parts of the world. Similarly, Vietnam also struggled with their internal economic situation, of course, but these factors were essential. The poorest part of the population, such as street vendors and hawkers, did suffer the most, and this was also seen in India, Bangladesh, and Pakistan. Local authorities provide free masks and rice to those people from the rice ATMs located in the main cities. So this is similar to what we have seen videos around in some countries where the poor are being helped by not-for-profit organizations with rice packets. But in Vietnam, this was done straight away through the government very openly. They set up pop-up rice ATMs, and people walked up to the ATMs and literally, I mean, the concept is like that of a money-based financial ATM, but this was a rice ATM. Moreover, the government began paying out monthly benefits to their citizens as well, especially those who had no employment and those who were unemployed. Special unemployment insurance was paid and are sponsored by the government as well. So basic necessities that are required by the people to survive in this particular situation. They started paying people out on a monthly basis and started giving them out food. Now, one of the reasons why Vietnam was able to react, you must be wondering, okay, they reacted to WHO, which is fine, but once again, what really got them at the top of their game, and one of the main reasons is that they did experience such viruses in the past. They had experienced SARS in 2003 and human cases of avian influenza between 2004 and 2010. So they had this experience, something had happened in their country in the past, so they were prepared. They had both the experience and the infrastructure to take the appropriate action. Now, a younger population isolated themselves to the medical system, could focus on resources on the critical cases, that of old people. So it was very clear. Young people isolated themselves. They didn't want to be a burden on the healthcare system. So there was a very responsible attitude from the younger generation, not being reckless at all. So the medical facilities, the hospitals could purely worry about and take care of the vulnerable old people or people who are having an ongoing medical situation or illness or an ailment. So this was a very responsible reaction from the younger population as well. Now, Vietnam has long maintained a robust system to collect and aggregate data from public health entities. So public health entities and the governments, of course, they really work well together. They collect data, and it has shifted to a nearly real-time web-based system in 2009, where hospitals within 24 hours or within a few hours literally report to the government if they find a particular virus or they find an unusual case, unusual patient, okay, or unusual symptoms. So that is reported directly to the government through this online web-based system, which is specifically maintained to cut out all the delays in reporting medical emergencies. So since 2016, hospitals in Vietnam are required to report notifiable diseases within 24 hours to central database, ensuring that the Ministry of Health can track the developments across the country in real time. So they also have event-based surveillance systems that empower members of the public, including teachers, lecturers, pharmacists, even religious leaders and community leaders, even traditional medicine healers, to report public health events. So if they see something unusual, they report straight away using the web data system. It goes to the central database and the health ministry can take action. All this can be done within 24 hours. Now, healthcare investments were the key in this success as well. So Vietnam has invested heavily in its healthcare system, with public health expenditures per capita increasing an average rate of 9% per year. So that is a very high rate. And between 2000 to 2016, for example, the average increase in the per capita spending by the government on public healthcare or expenditure was increasing by 9%. So this is the key really over here. And once again, for those who are going to argue, well, are they at war or it must be because they're developed? I've given the facts at the start. They're densely populated. They're not very developed. They're not a rich country. They have border issues. They have religious diversity as well. So all this excess spending by the government on healthcare is despite the issues that Vietnam is facing. Now, these investments have paid off with rapidly improving health indicators between 1990 and 2015. For example, the life expectancy in Vietnam rose from 71 years to 75 years. And the infant mortality rate fell, which is good, from 36.9 deaths per 1,000 live births in 1990 to 16.5 deaths in 2018. So massive drop, which is very good. We need as less. In fact, we need to come to zero when it comes to infant mortality rate. And the maternal mortality rate also plummeted from 139 deaths per 100,000 to 54. So the healthcare investments have been working. People's lives are being saved, literally. The 2018 immunization rate for measles in children between the ages of 12 to 23 months is also over 97%. So they're doing very good with the immunization as well. What was also very significant when it comes to the case of Vietnam is the third-degree contact tracing that was conducted. So this is a very noteworthy aspect of their approach. To keep it very simple, they weren't just looking at people who showed the symptoms. They weren't just looking at people who had come in contact with someone. They had a 3-degree contact tracing. So if someone had come in contact, they would check who lived with that person, who did that person come in touch with. And they would also look at who those people who were at a risk, who they had come in touch with. So it was like literally saying level 1, level 2, level 3. So that level of contact tracing was conducted. Now, a high portion of the cases that never developed symptoms was 43% in Vietnam. And I think even around the world right now, we are talking about people who are not showing any symptoms, but are carriers of the virus. Vietnam, they actually they were actually tackling this situation right from the beginning. So they didn't just look at people who are coughing or who felt sick. This contact tracing put everyone in isolation. And I'll show you the numbers very soon, how a huge number of people were actually put into isolation. So I'll tell you how quickly this particular contact tracing works. If you look in the middle, this is the main patient. And then as we go out in the circles, it is the people who are coming in contact with this person. So the immediate people in contact, then if this person was in contact with the patient, which other people was that person in contact with? So that's the first degree F1. Then that person could be in contact with more people, so that is F2. And that person would be in contact with more people, so that is F3. So many people were put into isolation just because of one patient, and that's how they contained it. So once a patient with COVID-19 was identified, local public health officials, with support from other health professionals, security officers, and even military, they used the military straight away, and other civil servants are helped to identify and isolate these patients, of course, for 14 days. Now, all close contacts, F1, like I said, all the ones that were F2, F3, all of them were put into isolation for a period of 14 days. And because they followed this vigorous routine, it was easier for them to contain the virus. See, despite all the odds, Vietnam has set an example for containing the virus. And because of this contact tracing that I just said, do you want to guess how many people were in isolation just because of a few patients? Well, Vietnam's first case of COVID-19 was reported on 23rd January 2020. From 23rd January to 1st of May, over 200,000, so that's 200,000 people spent time in a quarantine facility. 2 lakh people in quarantine, 200,000 people. On 1st of May, 100 days into the outbreak, because of this, okay, Vietnam had confirmed just 270 cases despite extensive testing and with no community transmission since April 15th. To give you the perspective, imagine only 27 people have tested positive, okay? 270 people have tested positive. Because of those 270 people, 200,000 people spent time in a quarantine facility. This was the level at which they contained the situation, this is the level at which they were serious about the situation. And because of that, till date, there is no death in Vietnam because of COVID-19. So I think they deserve a round of applause for their efforts. Like really, really well done, Vietnam. So I hope you liked the lecture. I'm sure, okay, people who love critical thinking are going to have certain questions in their mind. They're going to have some comments as well. If you do have them, as I said, make sure you like and subscribe to the channel, like the video, and write your comment in the YouTube comment box, so that way I can interact with you even more. And of course, the world can interact with you as well. So take care, stay safe. There is a second wave coming in many countries. So make sure, just remember one thing, it's not about you, it is about other people. So whenever people say, well, I'm safe, I can take care of myself, it's okay, I can break the rules quickly. No, that's where the problem is. Don't think about yourself. Just ask yourself, are you going to infect somebody else because of the risk you're taking? You may not be showing any symptoms, but you could be a carrier. Remember, if you are reckless, somebody somewhere could be dying because of your reckless actions. So stay safe, just follow the rules, and let us contain this virus as much as possible, as soon as possible, so the world can get back to where we were before the COVID-19 situation. Of course, it's not going to be the same, and later on I will have a video that talks about life after the pandemic ends. But for now, stay safe, and I'll see you in my next video. Bye bye.